Well, September 25th marks World Pharmacist Day, and a new campaign has been launched now to mark the occasion. The Nova Scotia Pharmacy Regulator, or NSPR, they've launched a campaign called Redefining Pharmacy Care, and that's to educate the public, us, about pharmacists' broader healthcare role now and what quality, safe pharmacy care looks like. Beverly Zwicker is CEO with NSPR and joins me now for a chat about this. Good morning, Beverly. How you doing?
Good morning, Paul. I'm doing great. Thanks.
Excellent. Joining us from 1801 Hollis in downtown Halifax this morning. So tell us a bit about NSPR. What are you folks all about?
Yeah, so we are the regulator of the profession in Nova Scotia, and our sole mandate is to ensure that the public receives quality care from pharmacists, pharmacy technicians, and the pharmacies where they work. The public interest is our only focus, and we are committed to making sure that we protect the public interest in all things pertaining to the practice of pharmacy.
Wow, okay, so a big job there. And I know that you've launched this campaign this week to kind of coincide with the day of World Pharmacist Day. So what is the Redefining Pharmacy Care campaign all about, and why now for this one?
Yeah, well, the campaign at its heart is the reality that words matter, that what we think, what we believe to be true, affects our decisions, it affects the choices that we make. And we've identified that it's important to help the public rethink what care pharmacists can and should provide. And so we have submitted a proposal to the Oxford Dictionary to encourage them to update their definition, which is very limited to the traditional understanding of dispensing and providing medications. And in fact, pharmacists can provide a much wider and broader range of healthcare than that sort of traditional role that they've served.
And so that's kind of what caught my attention on the press release, Beverly, was the fact that you folks have submitted for a definition change for the Oxford Dictionary. How does that process work, and have you heard back from that?
We have not heard back. I expect that they go out and do their research. I will say that certainly in Nova Scotia, pharmacists have the broadest authority of all the provinces, and I would say of all the countries globally in terms of what they are able to practice. That being said, pharmacists across Canada and the US are doing much more than dispensing and providing medication. So I think when Oxford does its research, they'll find that, yes, this is truly an outdated definition. And, the dictionaries are a trusted reference for all of us to inform our understanding on many things. And so I think it is really important that they do ensure that their definitions are accurate.
Yeah. And I know you've been in this profession for 2 decades or something, 20 years. How has the profession evolved, not only going through school and getting educated to become a pharmacist, but to some of the things that they offer today? Must be quite the change.
There's been a tremendous change, just as our understanding sort of societally in the sophistication of medications and pharmaceutical sciences has changed. Pharmacists have been educated to incorporate that into their practice. And so, they are really bringing a deep and rich understanding of medications and also healthcare to their practice. And so their care is really, should be more clinically focused. We have pharmacy technicians, a whole other group of professionals within the profession that can take on the important and I think expertise is certainly required for dispensing. I don't want to take away from the importance of that role and the expertise that's required. And so we do have pharmacy technicians that we license to make sure that they have the competence and training to do that well and safely. And this is enabling the pharmacists to use their broader knowledge in healthcare, and in particular using their expertise in medications, so that individuals in their communities and collectively as a system, we are getting the full benefit of their knowledge as it pertains to how to use medications so that people get optimal health outcomes, minimizing harms and optimizing the good that can come from medications.
So how long is this campaign on for now, the Redefining Pharmacy Care, and how can Nova Scotians get involved or find out more information, Beverly?
Well, we launched it a couple of weeks ago, and it's going on for about 8 weeks. We do have a microsite. We'd really encourage the public to go to that microsite, redefiningpharmacycare.ca. There, they can find out about the different care needs that a pharmacist can provide, and also what it will look like. And I think that is really important in helping people rethink what care they can get from the pharmacy.
Yeah, I got a sense from what you're saying this morning that there's more that pharmacists can do as well, so we'll see what the future holds for the profession. As for today, a happy World Pharmacist Day to everybody out there, and thanks for the time, Beverly. We appreciate it.
Thank you, Paul. I appreciate the opportunity.
And if Oxford doesn't listen, there's always Wikipedia. You just go right online and you can update the definition there. Nobody will bat an eyelash at that one.